The ICU, intensive care, where state-of-the-art medical technology saves lives. Life support provided here prolongs life, but sometimes it can also prolong the end. ICU specialist Dr. Daren Heyland believes that is too often the case with very elderly or terminally ill patients.
We're applying the technology to the wrong patient at the wrong time and leading to this prolongation of the dying experience, which is not in the best interest of our patients nor their families. It's not a good quality death experience. Again, when you talk to people at in their living room in the comfort of their own home and say, you know, what do you see those final days looking like? They're not picturing a tube in their mouth hooked up to a machine, machines supporting their organs, devoid of anything familiar with lots of noise and bells and whistles. And that's what an intensive care unit is. So unfortunately, it is life-saving for many people, but when used inappropriately, it is prolonging the dying experience, which is increasing the suffering and the burden on patients and families.
The exact moment of death is always uncertain, but Dr. Heyland wants patients to think and talk about what is important to them in the final days, because without that conversation, the system will take over.
Is it something people want to talk about and think about?
No. Difficult subject matter, not just for patients but also for us as healthcare professionals, to bring up that you might be facing the end of your life, and therefore what kind of care might we be considering for you. That's a very difficult subject.
To get that dialogue going, Dr. Heyland and his research team at KGH have spent a decade developing groundbreaking communication aids to help patients and their families. This online survey gives them a voice and provides feedback to healthcare professionals.
Because if something isn't that important to a patient or family, well, then we don't need to fuss over it. If something is extremely important and they're very well satisfied with the care they're receiving, again, we don't need to fuss over that. But for those care aspects that patients and families near the end of life say, this is very important and I'm not satisfied with the care, it enables that information to be fed back to the healthcare team to address it and to improve the quality of the experience by focusing on those key aspects of care that the patient and family have labeled as deficient.
Tools like this can be translated and used around the world to improve end-of-life care.
I'm hoping they'll be used by a multitude of stakeholders in this game. First off, patients, if they're able to fill out a survey either on paper or online. Family members on behalf of the patient or for him or herself can fill it out either on paper or online. But I think we as healthcare professionals have some responsibility to take an accounting of how the care is going in the program, be that a ward or a palliative care unit or an intensive care unit or a home care-based unit. It can function as an evaluation instrument where we get a group of patients and we administer the survey just to get feedback on how satisfied our clients or our patients are. So it can be used both by patient and family or by healthcare professionals who are actually providing the care. Broadly speaking, it's improving the communication and decision making around the application of life-sustaining technologies at the end of life. That's our goal. That's our focus.
Every life will come to a close. A planned death can be a better quality death, not only for the patient, but for those left behind with the memories of those final days.